Hi there. Excuse me. My name is Rachel Baxter, and I work with the Healthcare Authority as the Behavioral Health Stable Housing Policy Lead for Transitional Aged Youth. I'm discussing the Youth and Young Adult Housing Response Team, previously known as the Rapid Response Team. So just a little history. In 2018, legislature expressed a goal that beginning in January 1st, 2021, any unaccompanied youth discharged from a publicly funded system of care would be discharged into safe and stable housing. The Office of Homeless Youth and the Department of Children, Youth, and Families were tasked to develop a plan supporting that goal. This report was completed in 2020 and is titled Improving Stability for Youth Exiting Systems of Care. With that report in mind, legislature passed Senate Bill 6560 to be put into law that no young person exiting a system of care would be released into homelessness. As a continuation of that work, House Bill 1905 was passed in 2022, which requires relevant state agencies to work together as part of the Youth and Young Adult Housing Response Team, also known as the Rapid Response Team. The Youth and Young Adult Housing Response Team was spearheaded and implemented by the Department of Children, Youth, and Families in equal partnership with the Office of Homeless Youth, the Healthcare Authority, the Developmental Disabilities Administration of the Department of Social and Health Services, and is tasked with creating a cross-agency group who will collect, track, and report data related to gaps and barriers to stable housing for young people exiting publicly funded systems of care. This includes the behavioral health systems, juvenile justice, Office of Homeless Youth Programs, and the child welfare systems. DCYF will receive all referrals to the YYHART for individual youth and young adults in need of resources to be able to attend those housing stability conversations. The Youth and Young Adult Housing Response Team completes case conferences and the coordination of resources to youth and young adults, families to secure appropriate housing and other support as they exit a publicly funded system of care. In addition, services and support must incorporate young adult voice and choice and be responsive to the individual needs of each young person. Unlike other system meetings, such as multi-system rounds, YYHART case conferencing meetings are centered on youth and young adult participation to establish their own housing goals. The response team convenes weekly with case conferencing happening twice a month and the other meetings to discuss cross-system planning. As part of the creation of the YYHART team, HCA received $427,000 from the General State Fund, which funded 3 positions that were created. Those positions are an occupational nurse consultant, a research manager, and my position as the Behavioral Health Stable Housing Policy Lead. 2 of these positions, the nurse consultant and myself, are core team members to ensure that any behavioral health programs have been referred to, that the managed care organizations are also part of the creative problem-solving conversations, and to address any technical assistance as needed in the future. Each member and some managed care organization members have completed the diversion training with Away Home Washington to learn how to engage in creative conversations to identify and establish possible housing options. Additionally, to gain access to the Youth Diversion Infrastructure Project, also known as YDIP Flexible Funding, they each completed that training at Away Home Washington. This initiative was created to support young people financially to mitigate any barriers to housing. This fund can be utilized by the young person, a community provider assisting with discharge, and/or individuals, including landlords. YDIP funding is currently available within Clark, Pierce, Spokane, Walla Walla, and Yakima counties. Other community members that work with young people are also able to access the funding upon completion of the training. The following individuals can refer a young person to the Youth and Young Adult Housing Response Team: either the youth themselves, a family member, a case manager, an advocate, an educator, law enforcement, an OHY provider, and any contracted service providers that is working directly with the youth or young person. On this slide, you will find the referral form and the website information. When you have completed the referral, please ensure that the young person is being exited from a system of care and has not identified safe or stable housing. Once the referral is completed, the Youth and Young Adult Housing Response Team Manager will reach out to the referent to gather any additional information and to complete a release of information so that the team is able to discuss possible resources that may be beneficial to that young person. The manager will also identify any initial gaps or other possible programming the young person may qualify for. The manager will make connections with the related agency team members as well. After a plan is made, the manager will continue to follow up with the young person over the course of a year to ensure housing stability has been maintained. On the website, you will also find contact information for each of the core members and the agency that they are associated with. Thank you for your time, and I'll return it over to Jen.